Good afternoon, everyone, and welcome. My name is Amanda, and I am one of DWDC's program coordinators. Today, I'm joined by my colleague Taylor, our fellow program coordinator. Before we get started, we'd like to begin by acknowledging that the land on which we gather here today is the traditional territory of the Wendat, the Anishinaabe, the Haudenosaunee, Métis, and the Mississaugas of the Credit First Nation. These nations continue to experience ongoing colonization and displacement, and today Toronto is covered under Treaty Number 13 and the Williams Treaties. Dying with Dignity Canada is also mindful of broken treaties that occurred across Turtle Island and recognize our responsibilities as treaty people to engage in a continuous process of truth and reconciliation with all peoples across this land. I am thrilled to welcome you today. Through our webinars, we aim to provide you with information, key takeaways, as well as create a space for conversation on end-of-life topics alongside the professionals that know it best. Before I welcome today's speaker, I'd like to go over a few housekeeping items. Everyone on the call today is muted. However, there will be opportunities for you to submit your questions. To do so, please type your questions into the question bar on the Zoom side panel, and we will read it out for you at the end. In the interest of time, we ask that you please try to keep your questions as concise and clear as possible. And while we are going to try to get to as many audience questions as possible, unfortunately, we may not get to everyone. If you have any outstanding questions or questions that are quite personal in nature, we encourage you to email us at support@dyingwithdignity.ca, and we will follow up. This session is recorded, so there's no need to take notes if you don't want to. And finally, there will be a post-webinar survey that will pop up on your screen after the webinar and will give you the opportunity to share your feedback. And if you'd like to make sure that you receive regular updates from Dying with Dignity Canada on upcoming webinars, events, advocacy initiatives, make sure you're subscribed to any of the social media accounts that you see on your screen. We're also going to be including a link in the chat to sign up for our newsletter if you're interested. So without further ado, I'm now going to pass it on to Dr. Holly Prince from Lakehead University. She's kindly prepared a presentation for us in advance, so I'm going to go ahead and pass the floor on to her now. Holly, welcome, and thank you so much.
Miigwech. So I want to welcome everyone into this space today and extend my gratitude to the organizers for inviting me to speak with you today. And I'm here to share some knowledge and stories and experiences with you that I've gathered over the 20 years of working in the space of palliative care with Indigenous peoples. So over the next hour or so, there's a couple things that I'm hoping to accomplish and that we can work through and really talk about some of those health inequities experienced by Indigenous peoples, and introduce this concept of equity-informed approaches to care and to really explore those contributions that it could have on the health experiences of Indigenous peoples. And provide you with some strategies and some tools that you can use to challenge, your existing systems and programs and policies and practices to provide culturally safer care for Indigenous peoples. So I want to begin by paying my respects to the elders, past, present, and future, for they hold the knowledge, teachings, traditions, and future hopes of my people. So Bojo, Wijiwe Kwe Nadishna Kas, Thunderbin Donjiba, Anima Gozagi Donjiba, Makwado Dem. My English name is Holly Prince. My spirit name is Wijiwe, which means the woman who goes along with or journeys with people. And it was given to me in a vision by my Mishomis, my great-grandfather, about a year after my mother died. And my mother is that beautiful woman in the green sweater. So it is said that our spirit names are the names that are given to us before we came into this world. I come from the Makwado Dem, who are the Bear Clan, and they are the medicine people in Anishinaabe communities. I was born and raised in Beardmore, Ontario, home to the world's largest snowman. Google it, it's true. In the summer, he carries a fishing rod, and in the winter, he carries a curling broom. And those are literally Beardmore's two Olympic sports. And here I was raised on my traditional territory surrounding Animagozagigin, also known as Lake Nipigon. And it's that beautiful scene above that I get to go home to every summer and to be a part of it and to be on my ancestral territory. And this is where my ancestors have lived and thrived for over 6 generations. I am a registered Indian and member of Opawaganisining, which is translated to where the pipestone comes from, which is a signatory to the Robson-Superior Treaty of 1850. I have lived in Thunder Bay for over 20 years now on the territory of Enemki Waju, also known as Fort William First Nation, where I get to see Nana Bajo, or the sleeping giant, every day. And I live here with my husband, who is Anishinaabeg from Enigaming First Nation, located in the Treaty 3 territory, along with our three amazing children. So I'm a social worker by background, and I have a PhD in educational studies from Lakehead University, and I focus on decolonial and Indigenous education. And I'm deeply committed to the reactivation and revitalization of Indigenous knowledges and healthy caregiving networks to decolonize care for Indigenous peoples at the end of life. And I lead the Indigenous Peoples Health and Aging Division at the Center for Education and Research on Aging and Health at Lakehead University here in Thunder Bay. And this division has two main goals. So we partner with Indigenous peoples to lead culturally relevant research and education. And we also create space to amplify Indigenous peoples' voices through knowledge translation and program development. And I tell you about all of this about myself because locating myself in these discussions ensures accountability and authenticity to the communities that I work with, and it decolonizes my research. So as I present some things to you today, some teachings and some stories, I acknowledge that I am sharing these teachings and stories through the lens of my Anishinaabeg worldview. So one of our 7 sacred teachings as Anishinaabeg is the teaching of humility. And this means knowing yourself as a sacred part of creation and recognizing that you are here standing on the shoulders of others and building upon their knowledge and their wisdom. So I do want to acknowledge my ancestors, including my mother, for providing me with the love and the foundation that have enabled me to be here with you today. I also want to recognize the many elders who have guided me and mentored me and created space for me so that I can share their teachings from their families, communities, and nations throughout my journey. So I've been working in the field of palliative care for over 20 years now, and during this time, I've really come to understand the immense health challenges faced by Indigenous peoples. So Indigenous peoples in Canada are the fastest growing segment of the Canadian population, with an increase in numbers of over 40%, which is more than 4 times the growth of the rest of Canadians. We have relatively poor health outcomes compared to the rest of Canadians. So our life expectancy is up to 15 years shorter for Indigenous peoples as compared to other Canadians. Our rates of chronic and terminal illnesses are also higher amongst Indigenous peoples when age adjusted. And the occurrence of chronic diseases and illnesses increases with age, with more than approximately half of Indigenous peoples over 60 years or older reporting 4 or more chronic health conditions. So I'm here today to talk about palliative care. And within the field of palliative care, it's increasingly understood and being promoted as a basic human right. So we advocate for this. We all understand and agree that everyone should be provided with the opportunity to live and die with dignity. But yet, despite the emphasis on improving access, Indigenous people still have a profound lack of equity. Indigenous peoples are dying of illnesses that they would benefit from good care. However, programs that support people at the end of life are founded on Eurocentric knowledge, and these healthcare programs are not culturally relevant to Indigenous peoples, and they really create barriers to safe and equitable healthcare, in particular at the end of life. So, when we think about the care that's being delivered to Indigenous peoples, what we witness is a lot of jurisdictional issues in service delivery, and these really create barriers to seamless transitions and access to quality end of life care. So, this is probably one of my favorite quotes, and it's by a palliative care physician who was involved in some of the research that we did a few years ago. And he really speaks to the realities of what providing care to Indigenous peoples at the end of life looks like. So, what we witness in Indigenous communities is a lack of health services and providers in community. We see a lack of timely access to medications and equipment. Caregiver burnout is a concern where the healthcare providers who are providing care are the sons, daughters, nieces, and nephews of the people that they are caring for in a professional capacity. We also see that communities are in a fluctuating state of crisis due to things like traumatic death and suicide, which really overshadows the natural process of expected death. I had the privilege of working in one community in Northern Ontario, and they really wanted to engage in this process of developing and supporting better palliative care. And it became very evident that although they wanted to, they just couldn't, because as one of the members of leadership told me, was that we are just trying to keep our youth alive. And although we would love to provide better care to people who are dying of expected illnesses, those unexpected illnesses have to be the priority. So, what we're witnessing in communities is that Indigenous peoples would prefer to receive care in their communities and by Indigenous community healthcare providers. But there's numerous challenges in preventing this from happening. So, as a result, most Indigenous peoples must leave their communities to receive care, and they often die in urban or regional hospitals or long-term care homes, displaced from their communities, from their culture, from their traditions, from their language, and from their families. So it's been well documented in the literature that colonization is the primary cause of poor health for Indigenous peoples. It's also the foundation for a lack of equitable access to healthcare in Canada for Indigenous peoples. And colonization not only happened in the past, but continues to create harm and negatively impacts Indigenous peoples. So, colonization was built on racism. It was built on the belief that one group is superior to another group. And colonization began with the arrival of European settlers. And this involved the displacement of Indigenous peoples, the imposition of European laws and systems, and the suppression of Indigenous cultures and languages for the purposes of exerting control over land and resources. And I want to acknowledge my daughter, Gabrielle Prince, who created this amazing piece of artwork, which really reflects through a social justice lens this ongoing colonization experienced, not only within my generation, but within that next generation. So, what colonization did was it really forced policies and legislation onto Indigenous peoples to assimilate them into Eurocentric and Euro Canadian culture through the Indian Act. And one such policy was the establishment of residential schools, where Indigenous children were forcibly removed and stolen from their families and subjected to assimilationist policies. So these schools cause significant trauma and continue to have lasting negative impacts on Indigenous communities. And this picture is significant to me because it was a residential school that my grandfather was forced to attend when he was a child. So when we're thinking about this, where do we go? Recognizing that there's many things within our systems, within health systems, within education systems that continue to negatively impact Indigenous peoples. So where do we go from here, and what can be done right now to improve the health and care of Indigenous peoples? So I'm here to really talk about the significant contribution that equity-oriented approaches to palliative care can have on the health experience and access to care of Indigenous peoples. So, equity oriented care is about directing adequate resources to those with the greatest needs. It doesn't mean treating everyone equally because not everyone needs the same thing. And I recently heard this from a shelter worker that I had the privilege of working alongside. And he stated that he approaches care with this philosophy, quote, if someone needs it, they deserve it. So, really, in identifying equity oriented approaches to care for Indigenous peoples at the end of life, what we have to do is unlearn colonial logic that disregards Indigenous peoples' knowledges regarding health and caregiving and dying and death. We have to embed equity oriented approaches to care within the healthcare system and within providers' practices. So, in those Indigenous concepts of health and well being must be accepted, and support has to be given to Indigenous health systems. And these structural systems and policies imposed through colonization need to be challenged. Healthcare providers and people working within these systems have to also be willing to challenge their own power and privilege. So, as part of my efforts and some of the work that I do in community, I really focus on the reactivation of Indigenous knowledge and caring for people who are preparing to journey back to the spirit world. And my own research really focuses on engaging with Indigenous elders to gain insight into their views on health and wellness, caregiving, dying, and death, and how we can lead the way forward in reclaiming and reactivating our caregiving practices that were forcibly removed from our communities and from our experiences as a result of colonization. So now I'm going to share with you just a small glimpse into my culture and my knowledge and my caring and my ways of thinking of dying and death, health and wellness. So, from an Indigenous lens, health and wellness are about balancing the body, mind, and spirit. It's about being in relationship with one another and having a sense of belonging and connection with those around us. Being healthy does not mean the absence of illness, but really it's looking at balance across these four areas. And this is the Indigenous Wellness Framework that was developed through a national project that really focused around health and wellness. And within this framework, they really talked about how these four areas of spiritual, emotional, mental, and physical creates key outcomes when they're balanced. And so when we're looking at this in terms of what does that health and balance and wellness looks like, we recognize that things like spiritual wellness can create a sense of hope, and that emotional wellness creates that sense of belonging, and the mental wellness really creates that sense of meaning, and the physical wellness creates a sense of purpose. We also have foundational teachings, beautiful teachings on what that journey back to spirit world is all about. And Indigenous peoples have long-standing cultural and community-based knowledge of caregiving, dying, and death. We recognize dying as a spiritual process and one that is sacred. It's a natural part of our life cycle, and it's understood to be that transition to the spirit world back to Creator. And dying is really that process of becoming an ancestor. And this is a teaching, a beautiful teaching by Elton Beardy, who talks about how our teachings are embedded within our language. And when you break down parts of the word, they can hold such powerful understandings of our culture. And it's important to recognize, again, that as a part of colonization, one of the first things that they did was the removal of our language through the residential school system. So, in Indigenous communities, kinship and relational accountability are deeply ingrained in our beliefs. And the principle of caring for one another is embodied in the concept of family, which extends beyond the borders to encompass the wider community. Indigenous peoples do not distinguish between family and community when discussing caregiving because we believe the two are inseparable. And that's really depicted here with this dotted line. It really shows that understanding caregiving from an Indigenous lens really focuses on that integration between family and community. So this was really evident when somebody is nearing the end of life and the whole community comes together to support one another and keep vigil at the bedside. So the elders really emphasize that everyone is responsible for caring for people who are sick and ensuring that they are prepared to make that journey back to spirit world. And the elders speak extensively about the crucial role that family and community play in meeting that person's spiritual and emotional needs so that they are ready to move on to the next life. So when our dying and death ceremonies, our knowledges, our teachings, and our languages were demonized, colonization forcibly removed this knowledge from our communities. And the teachings that once helped to prepare us and support us were replaced with ideologies and teachings that were not our own. And colonization impacted something so sacred as our dying. So when we look towards equity-oriented care, we really need to challenge those colonial structures, including our healthcare system, that really continues to disempower and cause harm to Indigenous peoples. So this is a quote, a tweet actually, by Dr. James Makokis. And Dr. James Makokis, for those of you who do not know, is a Neheo from Saddle Lake Cree Nation. He's also a family physician, and he's the winner of season 7 of The Amazing Race Canada. And he really offers a critical insight into this issue during a recent keynote at an anti-Indigenous racism conference. He said that when filling out death certificates for Indigenous peoples, the most accurate cause of death to list on these forms is colonization. And this statement really underscores that fundamental reason behind poor health and that ongoing harm faced by Indigenous peoples. So we see in recent reports that the magnitude of racism that continues in our healthcare system as it relates to Indigenous peoples is pervasive. In particular, racism experienced by Indigenous women and girls, all of which has been exposed. And this really impacts Indigenous peoples' willingness to access healthcare, which negatively impacts their health and well-being. It's also important to note that racism impacts not only the people who access the healthcare system, but Indigenous peoples who work within the healthcare system. So it's important to reflect on that. So by not acknowledging colonization and really its role in creating these disadvantages for Indigenous peoples, what we do is we transfer responsibility to Indigenous peoples by saying that the fault somehow lies with them in their inability to be resilient, in their inability to evolve, in their inability to be healthy. So rather than really holding these colonial systems and racist systems accountable, so as you can see here, there's been numerous reports that people have the opportunity to review and to see the impact that racism has on the health and wellness of Indigenous peoples. And as I was creating this presentation and I started going down the rabbit hole, I started to see a lot of things within the media, within our news, that have been reported in terms of, for me, was very shocking. And one of the articles, as you can see in the bottom, was an article that was done by the National Post. And they were talking about the inequities in the healthcare system in Manitoba and how within these hospital settings, there were instances of babies being switched at birth. And as I was reading through this, it became really evident how systemic and ingrained that racism is. When a physician had reported, quote, personally, I was somewhat annoyed to see grown men weeping over an error 42 years ago. I had assumed they were raised in caring families. So one of the things that I want to acknowledge, again by Dr. James Makokis, is when he says that critiquing the system, it's not about critiquing individuals. And if people internalize it, it can immobilize us. So we need to acknowledge that our systems, including our health system, are inherently racist and do not support Indigenous ways of knowing, being, and doing. Our healthcare system, when it was developed, Indigenous peoples' knowledges were never taken into consideration. Our practices, our healers, many of that information and that knowledge was forcibly removed. We witness within our healthcare system research being conducted on Indigenous peoples, on Indigenous children within residential schools, nutritional research, where some children, received supplements and some children didn't receive anything in order to develop formula. So a lot of this different research that has been done on Indigenous peoples was done without the consent of Indigenous peoples. So we have to recognize that. So what I'm saying is this doesn't take away from all the amazing work that health and social care providers are doing. It doesn't take away the fact that they're good people, but it does mean that we need to acknowledge that these systems were never designed with our ways of knowing in mind and were never designed to keep Indigenous peoples healthy. So we have to start acknowledging the wisdom and the teachings and the experiences of Indigenous peoples. And as the Truth and Reconciliation of 2015 states, that without truth, justice, and healing, there could be no genuine reconciliation. But I would say, however, that we have to start looking at how can we develop trust, especially within healthcare. How can we develop trust within the system of ongoing racism? How can we develop trust around the experiences of colonization? So we can achieve this by embracing the principles and frameworks that cultural safety offers. So when I speak of cultural safety, it's important to note that cultural safety only occurs when Indigenous peoples tell you that they feel safe. It's not up to the Indigenous person or the family or the community to teach or to direct the organization. They can participate in those discussions, but really it's our role in the healthcare system. It's our role as healthcare providers to ensure that we are delivering safe care. And it's the organization's responsibility to ensure that they are creating safe spaces. So how do organizations create culturally safer programs and services for Indigenous peoples? So in a recent article by Alan and the team, they really described the importance of Indigenous-led healthcare partnerships. So they talked about encouraging people to go to ceremonies and community events, to attend powwows in your local areas, to participate in those discussions, to really focus on engagement and relationship building, to speak out in solidarity with Indigenous peoples, to amplify Indigenous peoples' voices, to really promote system changes on all levels, to look at ways to create Indigenous safe spaces. So really looking at how do you seek partnerships with local Indigenous elders and knowledge carriers? How do you develop an Indigenous guidance circle to direct these systems and really to work with local elders to provide some of that cultural education and staff? And when I reflect on this, there's a lot of things that people can do within these systems to recognize Indigenous ways of knowing, being, and doing. And when you're looking to engage with Indigenous peoples, recognize that when you're looking to bring in elders to share some teachings, to share some knowledge, to share some wisdom with your group, to really recognize and honor their wisdom and compensate them. And one of the things that I always promote within hospital settings is that I'll tell people, whatever it is that you are going to pay that physician to come and speak to your group, pay the elder the same, because they are the repositories of sacred knowledge for us as Indigenous peoples, and they are highly valued. And when I think about the number of Indigenous healthcare providers that are working within the systems, and really recognizing that we get called upon quite a bit to be able to support organizations' knowledge and really to provide some of that education, to really value that knowledge that people are giving. So really, when we look at this, what does it mean to challenge our own power structures and privilege? And how do we create those spaces for authentic relationships and care? And so we can do that by a lens of cultural humility. And cultural humility is really needed to provide cultural safer spaces. And when we think about cultural humility, it's really, that's what can contribute to a culturally safer system. So cultural humility is really that process of self-reflection to really look at ways to understand our personal systemic biases, to develop and maintain those respectful processes and relationships, based on mutual trust. And it really involves, humbly acknowledging yourself as a learner. And so this is the process of critical self-reflection. And it's really about examining and challenging our own power and privilege. So when we think about challenging and advancing our personal practice, how do we do that? How do we challenge that? How do we reflect? So really reflecting on your own biases and committing to professional development and cultural safety and anti-oppressive and anti-racist training. So there's a lot of opportunities currently out there that people can go, and a lot of these opportunities are free. One of which is a cultural safety training course developed by the Canadian Virtual Hospice that really focuses around cultural safety in the area of palliative care. And it walks people through a process of reflecting on their biases, of learning from Indigenous scholars and healthcare providers and people living with life-changing and life-limiting illnesses. Really prioritize getting to know your patients. In the work that I do nationally with a national group of elders, a knowledge carrier circle, they were really talking about the patient dignity question and what do I need to know about you as an individual to give you the best care possible. They had said, if my healthcare provider started with that question first, our relationship would have looked a lot different. So before we enter that space and that relationship with people, and if you're a healthcare provider, really reflecting on, what is your role and what are you doing in that space, to really examine and to really get to know them as individuals and to really understand how their culture and how their family and how their community impact their health and wellness. It's about really prioritizing to getting to know the people and the families and the communities and nations you are working with. So when you're looking at those nations and those communities, really understand the communities and the people that are entering your doors. Look and get to know the communities that are in your area. Go on the internet and Google them and find out who they are. And maybe if you've never been to their communities, go to their communities. Set up meetings with their communities. And one of the things that I always talk about is, and learn how to say their names properly. Learn how to say the traditional names properly. And in the world of Google, that's really easy to do. I do a lot of work nationally, and I don't speak every Indigenous language, So I too have to practice how to say communities' names and organizations' names, but it's a sign of respect and it shows that you're willing to get to know the people that you're working with. It's about acknowledging those social historical injustices that are affecting health. Really think about the lens of colonization. Enter that space, understanding the impact of colonization on the people that you're working with. Really recognize that rather than just addressing some of those overall outcomes, to try to get to know your patients and the people that you're working with better and the Indigenous peoples that you're entering relationships with. To really look at how do you celebrate the strengths and resilience. One of the things I say that when working with Indigenous peoples is, we have been living with over 150 years of structural violence and harm embedded within our experiences. But even over 150 years of that structural violence and harm, we're still here and we are a resilient people. And I've heard from an elder who said, we are more than resilient, we are relentless. So look at ways that you could work with healers and elders and look at ways to bring in those traditional practitioners to value that traditional medicine equally with biomedicine. So really in challenging and advancing your personal practice, really engage in these daily acts of reconciliation. And when people want to discuss reconciliation with me, I'll always ask them if they have read these 4 seminal documents. So the Royal Commission on Aboriginal Peoples, the Missing Murdered Indigenous Women and Girls Final Report, the Truth and Reconciliation Commission of Canada Calls to Action, and the United Nations Declaration on the Rights of Indigenous Peoples. And if they haven't read these 4 documents, I will not engage in discussions with them because they haven't even done their work. So do your work. So Dr. Kathy Apslin, who is an Indigenous scholar from Flying Post First Nation, shared that there is medicine in diversity, and sameness doesn't belong, and diversity is natural. And she explains that life wouldn't exist if there was only one type of plant or only one type of animal in this world. So why would we think that only one knowledge system or that there is only one way to care for people is the way moving forward? So when I talk about embracing a health equity oriented lens, it's really that crucial step towards improving the health outcomes and end of life care of Indigenous peoples. It's about challenging those colonial systems that have really created the disparities for Indigenous peoples. So I encourage you to reach out to the people in the community in your area. Learn from them. Learn what their knowledges are about. Learn about their ways that they provide caregiving. Learn about the ways that they think about health and wellness and dying and death. Incorporate that into the work that you do, into the practice. I also encourage you to really think about your organizations or the systems that you work in and really reflect on how can you work within that system to make a culturally safer system. And when I say culturally safer system, I really reflect on a teaching that was given to me by Elder Albert McLeod. And he really talks about, because these systems were never designed by Indigenous peoples, they were never founded on Indigenous ways of knowing, being, or doing. They were really founded on Eurocentric knowledge and this concept of colonization. And so when we do this work within this existing system, the only way that these systems, he says, would actually truly be culturally safe is if they were completely dismantled and rebuilt by Indigenous peoples. So all we can strive for is a culturally safer system. So when we think about these cultural safer systems, what are the things that you can do within those organizations to change, to look at equity-oriented care principles, to really look at, it's not about treating everyone equally, but it's giving people what they need. It's also ensuring that the care really reflects Indigenous peoples' physical, cultural, social experiences, some of their values and beliefs, with spirituality, kinship, and relational accountability as the foundations and approaches to these care. In my research, I've had the honor and privilege of working with many elders from across Turtle Island. In my recent research, I was really looking at ways that we can reactivate our knowledges, the way we can reclaim our ways of caregiving, of our practices, of our teachings, of our languages. And I had the opportunity to work with some elders through some storytelling sessions and some circle sessions to look at ways that we can reignite and revitalize these teachings and these practices. And as I was going through that journey with these elders, I took it as an opportunity for my own decolonization and to really reflect on what palliative care is and how I was living in the space of palliative care and how I was working within that westernized healthcare system for so long that I really wanted the opportunity to learn about my own knowledge and about my own care systems. And I do think that that's the way we move forward. It's also about acknowledging that Indigenous peoples are in a process of reclaiming this knowledge, and that there's some people and some communities and some nations who don't know their inherent teachings. But I think if we live our lives, as Elder Betty McKenna has shared, thinking that we are somebody else's ancestor, it moves us in the right direction because we're not just living for the present, but we're also living for those next 7 generations. So I want to acknowledge that these discussions around inequitable access to healthcare, things like anti-racism, colonization, they're difficult. Being here presenting this to you as an Anishinaabe is difficult, and at times it can feel very unsafe. But I come to this discussion today recognizing my responsibility in this relationship with you all, really reflecting on what it is I can bring or add to the conversation. So, as non Indigenous peoples, these discussions may also be difficult for you too, because you have lived within this system. And some of these things that we talked about today, these biases, this lack of knowledge or understanding, may be so entrenched in your worldview that you cannot see it. And so these feelings, these discussions may bring up feelings of guilt or shame for the tragedies that have happened in the past. And this is not about feeling guilty for what has happened in the past. You nor I can change the past. But we are all accountable for what we do next in acknowledging our responsibility to move this conversation forward into action. So this is the work that we need to do together. It's about being open and willing to accept our roles and our privileges, which can be uncomfortable as it requires us to be vulnerable. So I really encourage you to be comfortable with the uncomfortable and embrace that discomfort that comes from moving where you're at to where you want to go. So if there's anything that I said today in some of my reflections that made you feel uncomfortable, I really encourage you to sit with it and reflect on it and really use it as an opportunity to grow and learn. There's a lot of things and there's a lot of teachings that I could share with you. And this is kind of only an overview of some of these big overarching principles and teachings around inequities in healthcare, in our health and well-being as Indigenous peoples, in the role that colonization has played and continues to play in our lives, and really just a brief introduction around equity-oriented principles. So I encourage you to sit with this information, take it back to your organizations, systems you work with, your families, and to really look at ways that you can embed and enact equity-oriented approaches to healthcare, the ways that you can think about cultural safety within your systems or within your organizations, the way that you can embrace cultural humility in the unlearning of colonial logic, in the critical self-reflective practice. So with that, I'd like to say miigwech to everyone here today. I wanted to make sure that I have a lot of time so that we could have some really great discussions. So in my language, there is no word for goodbye. As we truly believe we will all see each other again in the spirit world. So with that, I would like to say Bama P until we meet again. And I would like to open it up to have some discussions with people.
Okay, thank you so much, Holly, for that thorough, insightful, informative, passionate presentation. We got lots of feedback throughout the session from audience members just expressing their support, their interest. I know I certainly learned a lot from it. So, without further ado, let's use this extra time you provided for us to get to some of the questions. So this audience member asks, and they recognize that it can be a different answer for members of different Indigenous nations. So they wanted to ask in the context of your Anishinaabeg worldview, how does one become an elder or be considered an elder in their community?
Yeah, I think that's very community or nation specific. So we use the term elder or knowledge carrier or knowledge keeper in a number of different ways. So being an elder in some communities can mean, quote unquote, being a senior, so someone of a certain age. But an elder really is that repository of sacred knowledge, and they are the ones that have been tasked with carrying that knowledge to the next generation. So they are involved in that sacred knowledge, that spiritual knowledge, and those cultural teachings that was given to them by the community themselves, but also by their ancestors and by Creator. So one of the foundational principles of Indigenous worldviews is the belief that we are spiritual beings first. So we are spiritual beings having a human experience, which really differs a lot from some of those westernized approaches to being. And so when we think of that, all of the teachings, everything that we come to this world, we recognize that it was already decided long before we came to the earth. So a lot of those are through negotiations and discussions that we would have with Creator and Spirit world. So our ancestors give these teachings to our elders, and our elders are the repositories of that sacred knowledge. So again, it's a little bit different depending on which nation or community you're working with, but it's recognizing that it's something that is handed to them, it's passed down to them.
Thank you. And thanks to the audience member for that wonderful question. Next up, this is an audience member who is a healthcare provider, and they're wondering if there's anywhere that they could start in terms of looking for suggestions or previous strategies for policy changes that they could bring forth to their managers, presumably in a healthcare site or institution, about how to provide culturally safer or more culturally appropriate care for Indigenous persons.
Yeah, absolutely. So again, I want to say miigwech to you for putting the Canadian Virtual Hospice's information. So in my other role outside of Lakehead University, I do lead the Canadian Virtual Hospice's livingmyculture.ca initiative, which really focuses around the livingmyculture.ca project. And in that project, we do have a number of different opportunities and learnings available for everyone. They're all available for free. They are on the website, including the cultural safety modules. We have a couple of other things around advanced care planning and person-centered care. There's been a lot of work done out there, including the work that I do at Lakehead University around ways to improve the care of Indigenous peoples as they prepare to journey back to spirit world. We were involved in a 5-year Canadian Institute of Health Research funded project that was called Improving End of Life Care in First Nations Community. It's the acronym is EOLFN, and we can put it in the chat. But if you go to that site, you're going to see a lot of different resources designed to support Indigenous healthcare providers in community, but also non-Indigenous healthcare providers who are working within those systems of hospitals, home care programs outside of the First Nations community. So the First Nations communities had developed a process for developing a palliative care program within their communities. And there's also a workbook there for non-Indigenous external healthcare providers to support that process as well. So you can take a look at that. There's also a couple of policy documents that are available on that website that really talks about how to engage in that provincially funded healthcare system, but also that federally funded healthcare system to improve culturally safer care for Indigenous peoples.
Okay, thank you so much. And as a follow-up question, you bring up the topic of advanced care planning, and this is just out of curiosity. But I wonder if you could talk a little bit more about the knowledge and the experience of Indigenous persons and how that intersects with advanced care planning. A lot of advanced care directives or the laws that underpin advanced care planning are based in federal or provincial legislation and based in those same settler colonial systems. So I'm wondering if that process or that experience looks different. And of course, again, it's a very wide net we're casting, but maybe just in the communities that you've researched or worked alongside.
Yeah, great. And that's a great question. And I thank people for thinking this far ahead. So, one of the things that when we do a lot of education, so part of my role here at the Center for Education and Research on Aging and Health is we go across Canada to provide education for Indigenous peoples and Indigenous communities around palliative care. So really centering it on palliative care, giving people that language from that westernized knowledge system, but then embedding it with our own knowledges by the support of elders or knowledge carriers. So advanced care planning has been something that I would say has been an interesting topic for two reasons. Number one, advanced care planning, as the person who had asked the question says, it is a westernized concept. It's based on westernized knowledge. It's based on a very individualistic approach to consent. It's based on an individualistic process of what I would want in the event that I cannot speak for myself, who would be my spokesperson, and what are those things that I would want that person to know. Secondly, we have also embedded advanced care planning in palliative care, which at times can be a little bit of a challenge or a disservice because we have already embedded in palliative care, and now we're trying to separate it by ensuring that people understand that it isn't about death and dying. So when we do our education, we are very cognizant of those two things. So the first thing we always do in community is really decipher that advanced care planning is not about death and dying. It actually has nothing to do with death and dying. It has everything to do with ways that we could support good conversations and to ensure that your wishes are expressed. And then the second part of it, again, is to challenge some of those colonial constructs, recognizing that it is not based in community. So when we think about advanced care planning, there's a couple of things that we really promote. And again, through the Canadian Virtual Hospice, we've developed the Coming Full Circle booklet. And this is a booklet that has been highlighted as best practice, not just for Indigenous peoples, although it was designed by Indigenous peoples for Indigenous peoples. It's a really great document that I encourage people to take a look at in having conversations about care and wishes for care, as well as people's values and beliefs. So it's a document that can support having those discussions. It's something that I encourage all of the Indigenous home care programs to embed into their packages in terms of when people come onto their care list. So there's a lot of really great work and resources that have been done in that space, as well as for the improving end of life care in First Nations communities, which I put in the chat. If you can share that with everybody. There's also several other documents as well. But one of the things that we have really looked at is really around this provincial legislation, because again, depending on which province people are coming from, that legislation really varies. So we have really taken a step back and really have deciphered between advanced care planning and consented capacity. And how do we promote those good conversations about people's values, wishes, and beliefs for future health and social care? And how do we promote them looking at who that substitute decision maker is or who that appropriate spokesperson is? One of the things I want to flag for people is a lot of these discussions are not occurring in community. And I think that's pretty, I would say that's pretty true across Canadians as well. But one of the things that we always caution people is when Indigenous peoples are entering that healthcare system, when they're entering that hospital system, for instance, and they're bringing somebody along with them, that might be just that person's medical escort and not necessarily their spokesperson or their proxy or their substitute decision maker. So we talk about the ability and responsibility as healthcare providers to untangle that. That's our responsibility to ensure that we're getting informed consent by by that appropriate person. So again, there's resources out there that we could share with you around advanced care planning, things that have been designed and developed to support those conversations that were designed with Indigenous elders and knowledge carriers, as well as Indigenous scholars and healthcare providers.
Okay, thank you so much. Lots to talk about and explore there. So hopefully our audience member derived a lot from that. This next question, this audience member is curious about caregivers or the caregiving experience, particularly for those who are of an advanced age, have a life-limiting diagnosis, or at an end of life. I wonder if you could expand a bit more from your presentation about what that caregiver experience looks like. If there are common stressors or challenges that they experience that might be different or very much the same.
Thank you for that. So, first off, as always, I'm going to send you guys to a couple of different resources. So, one of the things that we do at our center, as I said, is provide education for health and social care providers. And in that education, we have really heard from community caregivers the need for community-based education. So in the wise words of, Dr. Alan Kelly here, who talks about 90 to 95% of a person's care is delivered by family community. But yet it seems like, from my perspective, we only really focus on that 5% or 5 to 10% of a person's care by health and social care providers, because that's who typically we provide education to, and that's where all the resources go to. So we've heard that in community, there is a high need for community caregivers in terms of education. And so when we think about those Indigenous communities and people that I've had the privilege of working alongside, one of the biggest unique experiences of Indigenous peoples is even as a professional healthcare provider in community. As I said in my presentation, we really are the sons, daughters, nieces, and nephews of people we're providing care for. It's a unique experience that you won't even find in many rural communities in Canada. So in Indigenous communities, when we talk about caregivers, they don't differentiate between a family, a community, and a healthcare provider. Because those healthcare providers, when they're, say, in home care, I've worked with a healthcare provider who had a client list of about 40 people. She was the home care coordinator, and yet she was providing care in her professional capacity within the program to probably about more than half of those people were her family members. So there's no distinction between when somebody is a care provider or when they are a family and a community member. And so that's really unique. So when we talk about this idea or this concept of creating boundaries or creating good helping relationships or self-care, it's really important in an Indigenous communities that we are supporting those caregivers, because in this context of this individual I was working with, she was providing care for her own grandmother and her own aunts. And when her grandmother died, she was still expected to carry on in her professional role of caring for those other 39 people in her community. When we think about that, that creates unique challenges around grief and loss, around debriefing, around self-care, and how do we support communities. When I think about those family and community caregivers that we are working with right now, we are developing tools and resources to support them, to support their educational needs, to recognize some of the challenges that they're experiencing in community. Having had the own privilege of caring for my mother in the city of Thunder Bay, I know how quickly things change in a person's care, in particular at end of life. How quickly medications change, how quickly those needs change. And I recognized when I was caring for my own mother how difficult that was. When I had access to a hospital 5 minutes away, I had a pharmacy across the street. I had access to home care nursing. And basically, because I work in this field, all the people that I was working with were my colleagues. They were my friends. And I had access to them, 24/7 a day. And so I remember going through that experience and recognizing if it's this difficult for me, what is this like for somebody living in a remote, isolated community that doesn't have access to all this? So there is unique challenges in caregiving when it comes to end of life for Indigenous peoples because of all those inequities, because of all those challenges, because of all those barriers and things that they do not have that's not comparable to the provincially funded healthcare system. So we've created some tools and resources. We've created an online curriculum with everybody here can access. It's called Walking Alongside. It's available on our center's website. And in that, it walks people through the process of what it looks like to care for somebody with chronic disease or at end of life. It provides them with the tools and resources. It provides them with things around physical care, emotional care, spiritual care, and mental care. It provides them with a lot of tools and videos on how to do things. And in addition to that, through a recent partnership that our center has with the Ontario Caregivers Organization, we work with them to help them to develop an Indigenous specific I am a caregiver toolkit. And so there's a lot of resources out there that can support that. But again, I just want to highlight that the needs are quite unique because of those challenges and those barriers and those access to things like providers and services and programs, medications and equipment. And that becomes even more heightened when you're working in a community that's not road accessible, that's flying, that's remote. So a lot of that planning has to be done and is being done by people who are working in and living in that community.
Okay. Thank you so much, Holly, for that question. We're going to switch gears slightly. You mentioned a few things during your presentation about how to, rather than, truth and reconciliation, one of the more important or the first things to establish being trust. And I'd like to flip the question on its head a bit and ask instead, what are some actions that healthcare providers or members in the healthcare space take that build mistrust with Indigenous persons when receiving care? Do you have any examples that you can think of from your time working alongside communities?
Absolutely. So I think a lot of it, and just I'll talk from my own experience as someone who has entered the healthcare system with my family members. There's a lot of assumptions made and that's based on Indigenous peoples, and there are assumptions based in racism. There's assumptions around people accessing the healthcare system, all based on racism. And so when I think about as an Indigenous person, when I'm entering a space, color is an issue. And when people, I remember I was doing a presentation one time at an international conference, and I had made the point that Indigenous peoples experience racism within the healthcare system. And the healthcare provider came up to me, and he was very upset at the comment that I had made, and he said, "I treat everyone the same." And I remember thinking this as a teachable moment, and I let him have his say. But I said, when we say that like race doesn't exist or that color doesn't exist, and when we put this lens of color blindness on things, it does matter because just by being born Indigenous, I am 15 years less in terms of my life expectancy. I have higher rates of illness and chronic disease by just being born Indigenous. I'm accessing a healthcare system that was never designed for me to be healthy or to succeed. So when we say things like that, it discredits Indigenous people's experiences and it does place blame on Indigenous peoples. And their inability to be resilient or to evolve to a situation, as I said, rather than holding these colonial systems accountable. So when we think about that mistrust, there's already a mistrust of that healthcare system based on 150 years of structural and violence and harm embedded within that system of care. I'll give you an example. When we walk into a restaurant, my husband and I, and if people turn around, they look at us, there's an immediate feeling of, are they looking at us because we don't belong here? Or are they looking at us because I have toilet paper on the bottom of my shoe? People who are not, for instance, Indigenous would never, ever, that wouldn't be the first thing that comes to their mind. So I think about all these things that build that mistrust, not pronouncing people's names correctly, not making the effort to know an individual's names or the communities that they're from, taking the stance, for instance, that people are actually in the healthcare system are not doing so with the best intentions or the greatest intentions. There's a lot of things, but they're all based in racism. They're all based in systems that were never designed for Indigenous peoples to succeed. We think about our healthcare system, we think about our education system, we think about our justice system. All of these systems, when you look at Indigenous peoples, for instance, in the justice system, highly overrepresented in the justice system. So we have to think about this and we have to peel back those layers and we have to say, why is that happening? Why do people experience this? So lots of examples that I could give you around how people don't create trust. And so I would encourage people to really think about how do you engage in that critical self-reflective practice. And it's not about learning about Indigenous peoples, it's learning about yourself, to really unpack what have you learned about Indigenous peoples? Who taught it to you? What haven't you learned about Indigenous peoples? Why weren't you taught about treaties in school? Why weren't you taught about residential schools in school? And think about all of those things that have built your knowledge system. Who was teaching it to you? Did you ever learn from an Indigenous person about their experiences? And as I always said, now that you know that you cannot unknow, I've given you a lot of resources over the past hour to really start doing your own work, to unlearn your colonial way of thinking, to recognize that Indigenous people's knowledges are longstanding and they're extensive and they hold a lot of cultural knowledge, in particular around caregiving at end of life.
Thank you. We've just got a few minutes left here before we have to wrap up. One of my follow-up questions actually speaks to something in your answer. Why is it important when somebody wants to do the work of reconciliation or to understand more about themselves? Why is it important that they need, as non-Indigenous people, they need to do that work themselves? They need to do that research themselves, as opposed to just, petitioning Indigenous person to sort of give them the full spiel, if you will. Why is it important that they do the work themselves? What burden does that take off of the Indigenous person in
Oh,
question?
first off, it's a huge burden to place out on Indigenous peoples because it's not our responsibility to teach you. This is your system of care. This is your healthcare system. This is your history and present day experiences too. So we as Indigenous peoples have been living with this. We have understood colonialism since the time of contact. We understand how policies and systems were put in place. We live it every day. Again, as I said, just being born Indigenous, I'm already considered quote unquote less than in our systems of care, in our healthcare system, in our education system. Because if I wasn't considered less than, my life expectancy would be equivalent to anybody else in this country that we now call Canada. So when we put that on Indigenous peoples, it creates an enormous burden on Indigenous peoples to reteach, to relive, to re-experience all of that colonial harm. And recognizing that all of this work has been done, there are some really amazing courses that are currently out there that have already been developed by Indigenous people, such as the Sanyas Cultural Safety Course. The University of Alberta has a cultural safety course. Canadian Virtual Hospice have one specifically on Indigenous peoples at end of life. So the work has already been done. So I see it as we're engaging in a relationship. It's a relationship that we are both accountable to. So I come here today to share some knowledge and teachings with you. And you can walk away and you can say, well, I don't really agree with what she said. And that's okay. When I put things out there, I don't own it after that. How people interpret, incorporate, not incorporate into their lives is completely up to them. It's their responsibility to move that conversation forward. But you cannot unlearn what you've already learned. So, really recognizing what is that responsibility to this relationship. So, when we talk about treaties, non-Indigenous peoples are benefits of treaties. They're beneficiaries of that relationship, and you continue to benefit from colonialism. As Indigenous peoples, we have inherent rights to this land and to the things that we do and to our knowledges. And so it's a part of our responsibility of coming together in this relationship. So it's recognizing that I bring things, you also bring things. And what we take away is how we continue to grow and learn.
Thank you for that. We've just got two more questions before we'll wrap it up for today. You mentioned one of the ways that healthcare providers or members of the healthcare institution build mistrust by failing to learn how to pronounce names or pronounce nations or to have that cultural knowledge, that basic cultural knowledge. And
Mhm.
this audience member is curious if there are any tools or resources in specific that they could look up to be able to pronounce some of the phonetics or the teachings and learnings of Indigenous languages, if there's anything that you might have off the top of your head.
You know what? That's a really great question. And I always promote people to go out there and search because I work with an Inuk elder, and he used to say, in the world of the Google, you can find anything out. So even when I'm doing presentations, for instance, over in BC and Haida Gwaii territory, it's not my language. I don't know how to pronounce the thing. So I honestly I Google things and I Google things and I look for media launches or videos that were created by the community. And I play those videos and I listen phonetically to how they say it. And so I write it out in the way that I hear it phonetically. So I do this all the time. As an Indigenous person, I do that because you know what? When I go to that territory, when I go to that nation, when I'm working with those people, and I give it my best foot forward of how to pronounce their names and I study and I practice it, it's showing that I respect them, that I have made the effort to learn. So although I can't say there's one repository of all these things, I encourage you just to kind of take a look at it and listen to the videos and listen to auditory notes of what people say and how they pronounce their names. That's a
Okay,
great
thank you
question.
for that. Thanks to the Google. I want to end on this really important question here that an audience member submitted. They wrote, as a colonial settler or a newcomer to Canada, how does one transcend the shame and the guilt that you might experience after having learned about the way settler colonialism has treated and continues to impact Indigenous peoples?
I think that's a really great reflection. And again, as I said before, this is not about feeling guilty for what has happened in the past, but it's about recognizing that now you know you cannot unlearn and you cannot unknow. So how do you move this conversation forward? That's what we're held accountable to. Because I can't change what has happened in the past. If I could, believe me, I would. I would change the legacy and the history of residential schools, and I would change all of that. And although I continue to carry those harms with me every day, in my relearning of my language that was taken away and forcibly removed from my family, you too have the opportunity to do better. So now that you know, you cannot unknow. And now you are accountable for what you do next. So again, as I said, you can leave this webinar and say, that was a great webinar. She was pretty amazing. Or she might have said something I don't agree with it. And that's okay. You don't have to agree with everything that I say. But I've given you teachings, I've given you knowledge, and now you are accountable for what you do next. Because if you don't do something next, you're continue to live with that legacy of colonization and you continue to harm Indigenous peoples. And so, how do you move forward in a good way? That's completely up to you.
Okay. Well said. That is all of our time for today, everyone. I want to thank you so much for your undivided attention, for your comments, your questions. Holly, same thing to you. Thank you so much for the time and effort you've put together for this presentation. Your comments, your insights, your expertise were infectious throughout, and we received lots of positive feedback. So thank you, thank you, thank you so much for your time today.
Miigwech, everyone. Have a good rest of your day. Bamapi.